Hey everyone, so I just wanted to go over a STIM calendar with you guys. So anyone who has PCOS, so just kind of like you know what to expect. So I've seen different videos and things, people who just are going through IVF, and it's a little bit different when you do have PCOS than when you don't. So just some different things to expect. So we started off, what first surprised me is that they have you on birth control pills. And so I'm thinking, okay, we've been trying for over 4 years. Really, like, why are we going to have birth control pills? And so, but it's just to help suppress things and just make sure that when the eggs grow, that is just so they're all growing at the same time. So you don't want a bunch of different eggs at like a bunch of different sizes, because when they're doing the retrieval, you want them all to be nice and big so they're ready to go. So they started us, I'll just give you the dates that we started. We started in September, so they had me on the 27th, so for the birth control pills, we started with the cycle beforehand. So I was on that for, what, 1, 2, 3, yeah, so 3 weeks, just a full cycle birth control pills. And then the day before, oh no, that last week of our birth control pills is when we started Lupron. And so we just did like 10 units of that. It's a little smaller injection, and we did the Lupron, well, throughout the whole entire stimulation for the calendar, but that's when we started it. So that was just one injection in the belly. And when we did our IVS, and we were doing like the menopur and just the injections, they recommended to go almost like a star pattern around your belly button, because you don't want to do it in like the same spot over and over and over and over and over again. So we were starting to do that with these STIM medications as well. And you go in for a lot of blood tests. So as you know, with PCOS, we have a ton of follicles inside our ovaries. And with my body, they responded really, really well to the fertility medications. And so my estrogen level like skyrocketed. It went like through the roof so fast. It was like crazy. So like I'll give you an example. So our appointments are in the morning. We normally go in, and they take your vitals and they draw your blood. Get ready to have your blood drawn a lot. So what we did, let me see here, when we started, like I mentioned before, for a STIM calendar, we had 3 different shots and a couple different pills. On this Thursday, 10/23, that's when we started our actual stimulation. So we actually dropped down the Lupron a little bit to 5 units instead of 10. And we started off at 1 Follistim and 1 vial of Menopur. Prednisones there were 2 different, it's 2 pills, 2 prednisone pills, the prenatal, the folic acid, and then I was also taking my calcium and my vitamin D also. So that's something, if you do have PCOS, a lot of times that you're more at risk for osteoporosis, and so you should really be taking a calcium supplement if you aren't. So we did that, and as like a base, my estradiol level was a 43, so it was really low. And with the Follistim, we did 100. That was in units, right?
Follistim?
Yeah, it was 100 units, and that is like, it's like I don't know, what are they called? That's not an EpiPen. Like
injector pen.
Insulin.
Like an injector pen.
Yeah, like an injector pen. It's like click, and it's so weird because when you inject it, it actually makes that click sound all the way through. So don't get scared when you hear that, because it's totally normal. But normally, like, because I have PCOS, we started out at a much lower level than what my doctor usually starts his patients out at. So like, for example, for Follistim, he'd usually start them off at like 300 units. And so because I already had so many follicles in my ovaries, like I had 20 in each side at least. He's like, I can't even like sit here and count them all. We will be here all day long, which is like super exciting, because I was like, yeah, we have all these follicles. We're going to get as many eggs as we can, because you want to start off with like this many, so super many eggs. And then maybe after that, only this many of them will be mature. And then after that, maybe only this many will get fertilized. And then after this many are fertilized, only this many will make it to a couple days, and they just keep on like dropping off. So you want to start off with as many eggs as you can get, because this number is just going to keep getting smaller and smaller. So anyways, we're super excited. We had a lot of follicles to start off with. he started us off with like a lower follistim amount, and still menopur amount, only like 1 vial. There's been patients where they get more than 1 vial a day, and obviously our lower lupron. So I went in the 2 days later. So we started on a Thursday, right? Okay, so we did our blood work in the morning, got our base. We went in on Saturday morning, another blood work, everything like that. They called me and they're like, oh my gosh, my estradiol level went up to 1069. So it went from a 43 to 1069. It was a huge jump, obviously. So they said that because obviously if you have PCOS, you're at a higher risk for something called OHSS syndrome, which we did not want to get. And so they had me start going on this special diet to try and help prevent it. And so this is what the recommendation was. OHSS syndrome stands for ovarian hyperstimulation syndrome. And this was their recommendation as far as what to eat to help to try and prevent it. So they had me starting on this immediately for it because my levels jumped so high. After that, 2 days later, since it was so high, we went from 100 units of follistim down to 25. So we were taking just a little bit of these fertility medications because it was just, my body was responding so well to them, which was really good. But then the next week, we ended up having to go in every single day for blood work. Every single day, Monday through Friday. We were down there. It's like a 35-minute drive to the clinic. You had to be there at like 6:15 in the morning, so it was crazy. And that was the week of my birthday, so I'm like, oh yay! But so my estradiol levels continued to increase. So like I said, on that Saturday it was 1069. Monday it was 2336. 2336. Then the next day, 3529. And so because that Tuesday it increased even higher, they had me just totally stop the follistim because they're like, okay, your estradiol is like going like through the roof. It's going so high. We need to kind of like slow this down a little bit. These eggs are really going, having a lot of them. They're really worried about the OHSS syndrome. I mean, and it kept on going. It kept on going up and up and up. It went up each week until finally that Friday, which is Halloween, the day after my birthday. It was 8194 is what it got up to. And so that was the last blood test we did because in that Sunday we were going in for our egg retrieval. So, and I'll put some pictures up earlier. On Friday, well, I was still feeling like throughout this whole week I was feeling distended, I was feeling discomfort, I was feeling like bloating down in my lower abdominal region, and I felt very like sensitive. And so what it is, because your ovaries are so like full of all of these eggs, they literally like sag down. And so it's like the doctor gave a lot of recommendations like, okay, you can't do like any flips, you can't go on a trampoline, you can't go on any roller coasters or somersaults, and your exercise, you're just decreasing all of that because you don't want to risk any torsion of your ovaries because then you cut off blood supply and then you just killed your ovaries. So you have to be really careful about all of that and just take things like very slow, just nice and easy. And I mean, you're not going to want to be moving fast anyways because like with this, I was even, like I said, I was like walking like very tender. Like I felt like, I don't know, I was walking like I was an old lady or something like that, just super slow. My stomach, my lower abdomen was really distended. Like I said, I'll show you, put like some pictures on, and you can like see how much my lower abdomen was distended with that. So we went in for our procedure on a Sunday, and they retrieved 40 eggs. So we were so excited.